Thank you. Well, that's an awesome present. Can you hear me if I just leave this here? Probably, right? I have a fairly loud voice. You hear me in the background? Great. Well, I was tasked by Donna to talk about the management of very early adolescent pregnancies. And so that's what I'm going to do today. Hopefully we'll give you some insights. There's quite a bit of data, but fortunately, again, all this is available on for our website for the slides. You'll not get the pictures of my family, however, so I'm not going to give you those, sorry. And I will come up with some summaries, so if I'm going too fast, give me a wave. I am a Yankee, even though I live in West Virginia and have a southern Appalachian heart, so I do go quite rapidly. And is it narrowed down here? Oh, there we go. No commercial products. I'm not saying anything bad is mine, so don't blame AAPLOG, right? That's my disclaimer. Well, what I want to do is talk a little bit about, since you're really my wife, you're very German, you want to know everything is ordinum, right? It's the path, it's the order. If you're Irish like me, it's the journey. So for those of you that are very German, it's true. For those of you that are very German, I'm going to tell you the outline because we have to, for CME and also so that you feel very comfortable. I'm giving you a path, you'll feel a lot less stress. Talk about the care of adolescent pregnancies, talk about medical care a little bit, and then we'll learn how to advocate for this because this is a huge quote-unquote problem in the world. Well, let's talk about what that really means. This is my daughter Mercy, who's at Peabody, and with my little ginger granddaughter Penelope. Isn't she cute? Well, they're both cute. So what I did is I looked at basically 46 papers that I could find in the English literature. I went through and looked at all the English literature, looked through multiple databases, and I found 46 papers with pregnancy in early adolescence below 15 years of age or less is how I defined it, and that's how we define it. That's actually how who defines it and everybody else defines it in the literature. I had 20 papers with correct age in the cohort less than 15 years compared with older age groups of adolescents and or adults that had useful cohort comparisons. So this once again points to the very obvious fact that, well, sort of like the idea of Alice in Wonderland. You know, when Alice is talking to the caterpillar, or the Cheshire cat, he says, well, where do you want to go? And she says, well, I really don't know. Well, then anywhere will do, right? You have to know where you're going with this. I did 20 papers that I reviewed, and I'm going to talk about the number of patients involved, high to low. Well, the first paper I looked at was actually data from the United States and CDC linked data. There were 300,627 births, and what they looked at, these were all births that were theoretically 15 years or under from 1995 to 2004. And for those of you that love statistics like me, not, you look at odds ratios and try to find out if it does or doesn't cross 1, and look at the effects based on the higher the odds ratio, and look at the adjusted odds ratio, which is really what you want to look at if it's available. So if you looked at adolescent pregnancies less than 15, increased risk for very low birth weight, which is those who are below 1,500 grams for 32 weeks, low birth weight below 2,500 grams for 37 weeks, increased SGA for gestational age, increased risk for growth delay itself, not just gestational age growth delay, but actually less than the 10th percentile, increased risk for stillbirths, and increased risk for neonatal deaths, probably, if you're thinking, just separate it out, really related to preterm birth. If you looked at this data again and looked at the preterm delivery, again, less than that, 37 weeks, 32 weeks, 2,500 grams, and neonatal deaths. Again, it's a retrospective cohort study, CDC and Chen in 2007, very similar. Preterm birth increase, increased risk of SGA and low birth weight. If you look at Fraser in 1995, this was a cohort study by the state of Utah looking for about 20 years worth of data, and they had 15,000 babies. Okay, so these are relatively large numbers, but I want to show you this because there are some very large studies, and then we're going to go a little bit differently as we look at some other studies. Increased risk of low birth weight, again, very similar, 1.7, 1.8. Increased risk of prematurity, 1.9. SGA, again, about 30 or 40% increased risk, plus or minus. That's my granddaughter Katie, with my peonies as we call them. Isn't she cute? Yeah, she's cute too. That's my oldest son, Paul, who you get to see later. If you looked at another, again, a retrospective cohort study in Latin America, looking at the Center for Perinatology, they had 33,498 deliveries in Latin America, and compared them to adults usually greater than 18 to 21 years of age in this instance, Anemia they looked at was increased, operative deliveries increased, episiotomy, hemorrhage, endometritis, maternal death increased, low birth weight, very low birth weight, preterm birth, and very preterm birth, less than 32 weeks. So again, very similar results. So this is painting a pretty grim picture, isn't it? Well, it gets better, trust me. Small for gestational age, early neonatal death, again, very, but what decreased risk, what surprise, gestational diabetes, third trimester bleeding, and the evil cesarean delivery. So keep those in your brain as we go through some of this stuff. That's my daughter Faith. Faith is Floppy Faith, as I call her. Floppy Faith has been dying every year since she was born. Unfortunately, she's been 27 this year, so she's outlived probably her doctor, most of them anyway.
Right.
And she has. And she actually has a carnitine deficiency and requires full care, but does she look like an unhappy child? Of course not. She's a wonderful child and very interactive, but she'll make you think she's disabled. Not disabled, yeah. The only disability is in your mind, because she'll work you. Trust me. So, it's true. She'll pretend like she can't do anything the next minute she's got your car started, she's going out to get ice cream. So Gilbert did another study looking at California, 33,400 babies in less than 15. Infant death rates higher, death rates higher, prematurely related for the most part. Preterm delivery, low birth weight, a little increased risk of pileup, preeclampsia, severe preeclampsia less because probably that's chronic hypertension, right? Eclampsia a little bit higher, infectious complications a little bit higher. Again, looking at the same study with the Hispanic group, separating it out, infant death rates higher, neonatal death rates higher, preterm delivery rates, low birth weights, pyelonephritis, again, preeclampsia lower, severe preeclampsia lower, eclampsia a little bit higher, infectious complications a little bit higher in the subgroup of the Hispanic deliveries. Looking again at the Hispanic group again, infant death rates a little bit higher, neonatal death because of preterm delivery, again, preterm delivery, low birth weight, pyelo, preeclampsia, severe preeclampsia less, eclampsia not enough data, infectious complications not enough data. This is my son Paul. Paul's the big boy. Over here. And that is about 100-pound projectile winning the hearts and minds of the people down in the range. About 30 clicks, as we say. So while you're sitting home in bed at night, someone's out defending that, so just be aware of that. I thank you for your service all the time. That's where I wear my blue star. There you go. So there's another national risk study. And the reason I put this one is because what I want to show is what has been shown to us with the adolescent brain and development. And this is where I want to sort of us to think about as we move this discussion a little bit forward. I'm going to show some more stuff too. Tobacco use less than 12 years of age gave you an increased risk of 4 times the risk of not using it. Marijuana less than 14 years of age, which of course fries your brain and executive function, 3 times the risk for pregnancy. And when you get pregnancies below 15, what do you get? Preterm delivery, low birth weight. So what might be the thought we could look at when we're looking at teen pregnancies? What might we like to think about? Just what we've talked about. Parental involvement, increased ability to have executive function of parents, and discussions of the risky behaviors by adolescents. Again, they did another looking at daily cigarette use, and they found there's an 8 times increased risk in the second part follow-on study for pregnancy if you had cigarettes less than 12 years of age. We did a nice study out of Grady Memorial Hospital of almost 3,000 patients done back in Atlanta in I think the late 90s, looking at preeclampsia, eclampsia, preterm delivery again, very low birth weight, preterm delivery, preeclampsia, eclampsia, all increased in the less than 15-year-old group. That's Paul, which he always doesn't look like he's in the military anymore, he's in the Guard. And that's Dan. Dan is the redheaded kid who's the dad of Penelope, the little ginger, as we say. Parkland Hospital here in Texas, right? There's the Parkland way, and then there's everybody else's way. Yeah. Who's laughing about that? That's the way it is, right? Yeah, yeah, whatever. So they had about 1,600 babies babies that delivered between those 3 or 4 years. The average delivery rate was increased by, wow, look at that. Pregnancy-induced hypertension decreased. Wow, look at that. Cesareans for people with stress. Wow, look at that. Oxytocin augmentation. Wow, look at that. And cesarean for distortion. Wow, look at that. All decreased. Well, so now there is some positive stuff here, isn't there? Okay. Take the good with the bad, right?
Not really.
Induction is not significant. Again, looking at the very low birth weight increase, that's the other side of the story. Low birth weight increase, NICU basically prematurely increased, macrosomic babies for all of us who practice in West Virginia, thank you Jesus. 4,000 gram babies decreased. Stillbirth rate's not different, pH is not different, neonatal death's not different, adjusted not different. So looking at this data, as you can see, there's quite a mixture, isn't there? The Swedish birth registry had a small number of patients that they did, and we're looking internationally across the water, so to speak, in a socialized medicine country. What they found was, looking at retrospective cohorts, linking it with adults again, neonatal mortality slightly increased, 2.7 again because of prematurity mostly. Post-neonatal maturity increased because of, again, prematurity, preterm births, and very preterm births increased. This is me with an old girlfriend in New Orleans. Don't have nice little legs, I think. You only can be better side than Kel, right? Yeah, no. My wife made me put that picture, it's not my fault, I wasn't her. What about Brazil? So Brazil did a nice little study looking at retrospective cohort study again, and they did adjusted odds ratios, and they had about 1,400 increased risk of low birth weight, increased risk of preterm birth. So there's a recurring theme, isn't there? Preterm birth, very preterm birth, low birth weight. Look at University of Mississippi, a little bit closer to home. They had about 400 patients. They had an increased risk of low birth weight and preeclampsia, but nothing else was significant, although it's a much smaller study, right? There's only about 400 patients in that one. Global network in South America, Southeast Asia, they had 269,000 patients involved, of which 370 were 15 and below. These are all more adolescents. Increased risk of preterm birth, low birth weight, hemorrhage and postpartum, obstructive labor is not increased, no increased risk of stillbirth, no increased risk of sepsis, no increased risk of neonatal mortality less than 28 weeks, no increased risk of perinatal mortality, no increased risk of hypertensive disorders, again, a smaller number of patients. That's Barb, my daughter-in-law who has ushers, and Katie looking out over their West Virginia hills there. The University of Thailand, again, they had another smaller study looking at about 300 patients compared to greater than 20 years of age, increased risk of abortion, increased preterm risk, stillbirth rates. They have an APGAR issue, which none of the other studies seem to find, although small numbers. Again, increased risk of low birth weight and increased risk of fetal growth constriction and delay. They also looked at C-sections, which of course decreased, right? Decreased operative deliveries, decreased pregnancy-induced hypertension, decreased risk of preemia, and decreased risk of, or the postpartum hemorrhage is not seen, or PIA is not seen, I'm sorry. There was a study done at the University of Medical Center in Camden, New Jersey, again about 230 patients, again, preterm birth, decreased risk of gestational diabetes mellitus, a big problem that I have, and no pun intended in West Virginia, decreased cesarean section rate, and decreased perinatal laceration rates. Again, small numbers. That's Paul, looking very, very cool with his white barb, right? He looks kind of like a soldier, doesn't he? Oh. So another study in Ecuador, a number of about 200 patients, again, looking at the same thing again. No significance in severe preeclampsia, placental abruption, postpartum hemorrhage, or eclampsia. They looked at low birth weight was increased, adverse perinatal outcome increased, no significant difference in very low birth weights, preterm births, neonatal deaths, or SGA, in a smaller number of patients. That's Mercy, later on, getting ready to go to college. I think she's cute. Thank goodness she looks like her mother, don't you think? Yeah, that's a good thing. Well, another study we looked at was a study retrospective again at the University of Texas, Galveston, here close to home, and looking at 15 years of age with melliferous, 16 to 17, and 107 at 20 to 22. Again, looking at pregnancy-induced hypertension, they found no differences. Smaller number of patients. Another one in South Africa, looking at about 90 patients, they found increased risk for anemia and increased episiotomy rate. They did not find an increased risk for cesareans, PIH, eclampsia, GDMA, or mode of delivery. Again, smaller studies, smaller numbers. Another smaller study in Finland, they found increased risk of preeclampsia, eclampsia, preterm delivery, smaller. So mixed reviews. That's my lovely first wife, Catherine, as I call her. She is my first wife. She's also my only wife, but she's my lovely first wife. She hates when I do that. Women hate that, don't they? Get over it. She said, yes, I can't help you. Sorry, this is what it's doing. University of Maryland had a small number of patients, and what they found was if you put the patients under 15 in a teen clinic, another take-home message, guess what happens? they don't have low birth weight, they don't have preterm delivery, they do better. So perhaps, this is actually my experience in the military, which I don't have as detailed. I have mostly teen stuff I publish, not 15-year-old. If you take better care of patients, they tend to do what? Better. Imagine that. Yeah. It's kind of obvious. We had to write this stuff, don't we? Publish it, yeah. What about the University of Tennessee? They did looking at a multi-cohort study, looking at patients who had special clinic that they did, and that compared to 20 and 29-year-olds, when they put them in a good clinic, they really found that they had decreased section rates, and in labor they had no increased frequency of induction, analgesia, birth weights, preterm birth, or operative deliveries in small groups, and they compared them together. So labor and delivery was not different in the sense of those patients. Okay, now for those of you who might be easily offended, don't listen to this one. This is a military thing. This is part of your multicultural sensitivity, okay? I just want you to know that. Just my disclaimer. Father says Pooh as he chambers another round. This is Pooh Bear playing with Piglet, Rabbit, Eeyore, and Kanga, Baby Gru, an owl in the 100-acre woods. I'll let you think about that. If you're from West Virginia, you get that pretty easily, right? That's an Enfield. Don't you love it? Yeah. So, what's the summary of our complications? We have an increased risk of SGA, increased risk of low birth weight, increased risk of preterm delivery. But we have a decreased risk of diabetes mellitus. We have a decreased risk of cesarean sections, the evil C-section. We have a decreased risk of Pitocin and of delay in active phase. Plus or minus preeclampsia, plus or minus very low birth weight, less than 1,500 grams, plus or minus of the episiotomy instrumental deliveries. And doctors can't be wrong, right? This is a real ad, remember, this is not fake. If you smoke and you take up smoking, you have worse outcomes, right? And you get pregnant at earlier ages. So the message is, talk to our children. Don't do tobacco, don't do drugs, don't do THC, don't do alcohol. All of them are bad, right? They're all bad for your adolescent brain. The medical complications that you see that are not found in the youngers are related to older gravidas, hypertensive disease, and diabetes, all which are much higher than everybody over the age of 15, right? So if you look at preeclampsia and chronic hypertension, it's 20 to 25%. So if the preeclampsia risk is increased in women under the age of 15, we shouldn't let our chronic hypertensives get pregnant either, right? Because their risk for preeclampsia is actually as high or higher than a young woman who's under the age of 15, right? Truly. They also have a risk of preterm birth due to preeclampsia that's double, which is about what you saw, double to 1.5 to 3, right, for the preterm delivery rates for the adolescents. So they shouldn't get pregnant if you have chronic hypertension, because your risk for getting preterm deliveries is double what those who don't have it is, right? Do we tell that to our chronic hypertensive patients? Anybody in here say that to your chronic hypertension? I didn't think so. Okay, I'm just trying to make a point here. I know I'm old and stupid, but I'm just trying to think, if it's one then, I'm trying to use a little logic we talked about this morning, yeah. So increased risk of preterm birth due to preeclampsia is very real, and depending on the severity of your preeclampsia and your renal function, it will be significantly elevated, correct? Increased risk of perinatal mortality with chronic hypertension is 2.7, which is about the risk of these young women, 1.5 to 2 to 3.5. Less than 15, if they have a preterm delivery, the perinatal mortality is about the same, right? So if you're going to tell your young women to have abortions and not get pregnant, if that's what you believe, or they shouldn't be pregnant, then neither should your chronic hypertensives, right? I mean, really, seriously, neither should your chronic hypertensives. What about diabetes? None of you have that problem, do you? Well, let's just say in West Virginia, we lead in obesity, except for maybe one state, who will remain unnamed, it's below the Mason-Dixon line. But we're number 1 in tobacco. So with chronic hypertension, you double your rate of SGA if you also increase your primary cesarean section rate with vascular disease to 26%. With vascular disease, it's 38% risk for cesarean sections. Well, then you should get pregnant when you're 15 because it decreases your risk for C-sections, right? So if you're diabetic, you shouldn't get pregnant because you're going to have a C-section. Right? These are all from the ACOP and Reese's white classification stuff, okay? Preeclampsia is 15 to 20% of type 1 diabetic without nephropathy, up to 50% with nephropathy. So again, 15-year-olds should not have babies, and you should abort them all, then you really shouldn't let your diabetics with hypertension get pregnant now either, should you? Right? Right? Does anybody tell that to all their diabetics? They get pregnant to abort all their babies if you believe the medicine here? You know, even beside all the fact we don't like abortion? Well, there you go. It's the same data. Same data. I hope this doesn't offend anybody either. This is my military thing, so close your eyes. This is Curtis Duke will till you blow LeMay, 1963. If you kill enough of them, they stop fighting. True quote. It probably is applicable, but not what we're talking about. I just like Curtis LeMay. You gotta love a guy who's got a cigar like that. And SAC, under his command, Strategic Air Command, had quite a billion nuclear weapons, and not one time, unlike other places, not one time did they ever have a nuclear accident in the whole history of SAC while he was in command. Not one. Not one. So let's talk a little bit about psychological effects. Where am I at? How much time I got?
240. We got 20.
Very good. So psychological effects. I'm going to talk a little bit about that. Some of us talked about that last night. I want to talk about it now because my experience with adolescents in general and young women in general is that if you have abortions, things don't go well for you or those around you. Much higher risk for mental health visits if you abort, no matter when it is. 21% more health visits over 4 years after abortion, and it's worse for adolescents actually if you read the literature out of New Zealand. 154% increased risk for suicide in the Finnish literature, and that's carried over. It's actually worse than that for the under 19 year age. It's closer to almost 200 to 300% increased risk, 2 to 3 times the risk. Illicit drug use, what a surprise, right? If you have an abortion versus a live birth, your illicit drug use goes up by 460%. So it doesn't happen that way after deliveries, okay? We know that literature has been talked about. Actually, Priscilla may be presenting some more of that, but that's fairly well documented. 65% more likely to be high risk for clinical depression with an abortion versus a delivery across all ages, right? 34% increase in generalized anxiety, which is much higher in Hispanics. 42% higher risk for generalized anxiety in unmarried patients who have abortions, not increasing those who have babies. 40% higher risk if you're under the age of 20 years of age, which these 15-year-olds are. So much higher risk of generalized anxiety if you have an abortion compared to having a baby. No matter what you have, no matter what your age. This is one of my favorite slides. My daughter hates. This is Nemo's sushi bar in Japan. You thought they found it again. This is really where he was. That offends somebody. I'm really sorry. Don't shake your head. You brought me here. You invited me. Can't help it. 85% higher risk of sleep disorders at 6 months. 68% higher sleep disorders at a year. 40% higher. 41%. It doesn't go away. This is like post-traumatic stress stuff, right? Oh, you'll just get over it. Well, they just don't get over it. Okay? It doesn't work that way with abortion. Okay, so this is the group we're talking about. If you had 65 7th to 11th graders either aborting or giving birth, aborters were 5 times more likely in this small group to seek counseling, 4 times more likely to have sleep issues, and 6 times more likely to use THC, which we found previously was also related to having early pregnancies and having issues with the pregnancies themselves and becoming pregnant. That's Penelope, the ginger, eating ice cream with Daffy, or Grandma, she says, and yeah, she's so cute. That's the one. Grandchildren are just great, because you have to send them home. Yeah.
Right.
What about mortality rates? Well, mortality rates, if you look at looking at the stuff with Gisler and the Finnish database, which is fabulous stuff, because everything is linked and you have every medical thing going on, is about 370% higher within 1 year of abortion compared to a mom who delivers a baby. Death rates are 50% higher in aborting women compared to non-pregnant women, even in general. An 80% higher risk of dying in an accident within a year after having an abortion. Probably high risk behavior. If you look at mortality rates for those who abort compared to those who have babies, 81% violence, suicide, accidents, natural caused AIDS, all the things that go on with post-abortion stuff, which are not happening in 15 or 16-year-olds if they deliver. None of this happens. Okay? So not only is there decreased cesareans, decreased gestational diabetes, decreased risk for operative delivery, decreased risk for having large babies in macrosomia, None of this happens. Mortality related to abortion is about 9.3 per 100,000. If you look at maternal mortality, everybody talks about if you have a baby, you're going to die by the gabillions, right? Well, that's not really true, right? Yeah. In fact, I wrote a nice article if you want. I'll plug the Linacre shamelessly, Linacre Quarterly. I don't get anything from them, but I have an article in 2013 looking at maternal mortality specifically and breaking down why we don't really know maternal mortality in this country. But in fact, it's much higher with abortion if you look at all causes than if you look at delivering a baby. I just like this picture because it's sort of like there. Right? Nobody's out there right yet. It'd be a ruptured uterus, wouldn't it? What about breast cancer? Twice the increased risk. We've heard a lot about that previously. We discussed that in film last night. Again, there's my lovely first wife, Catherine Faye. Preterm birth, I'm just going to go quickly because I know you've got a great lecture on that coming up, which I'm really excited to hear. There's at least 145, I think it's 148 now, documented increased risk of preterm birth with abortion prior to the first incident of pregnancy. But of course, if you listened last night to certain people, they would say that's baloney, there's no increased risk. It's all a fairy tale. It's all junk science. All those 145 papers are junk science. I'm not going to go through all that. This is Paul at night, part of the 155. Don't you love this stuff? This is great stuff, isn't it? Well, why do we get preterm birth? We know there's some reasons why. Seminal infection, cervical trauma. I'm not going to go into a lot of that right now. I'm not going to go into that. We do know, however, if you look at causality and association, abortion precedes preterm birth. It's strong. There's at least 150 studies close to that now. More abortions, and the higher the risk, and the more risk you have. It's cervical injury and also seminal infection. This is the future of obstetrics for us. 1 hour delivery of the baby's free right now. That's the way you feel. It's like, it's like you get these people coming in, you got these people doing these like reviews of your care, and I go, this patient needs to go home, and I go, well, their blood pressure's 109,000 over 85. It's too bad, they only got 2 days. I gotta go. Really, who is this stuff? I'm not gonna do that, I'm not gonna do that. I do want to see that this will come up, maybe. Maybe not. Was my little baby going through withdrawal. If you look at pregnancies, much likely to use marijuana, illicit drugs, and alcohol. 200% higher risk for marijuana, crack cocaine itself, illicit drugs, tobacco risk. I have a 35% use of substances in my clinic documented. Virtually every one of those patients is either post-abortal or post-abuse. Every one of them. I only like Maxine because Maxine was my mother. She was Maxine. And it says I'm snowed in, nothing a little salt can't handle, especially around the rim of a margarita glass, right? So what about child abuse? 144% higher risk. In other words, what, 2.44% odds ratio. Miscarriage or stillbirth is not associated with child abuse. Cost to society, if you look at the taxes you lose from having one child aborted, it's about $32,000 cost to the Treasury. By being aborted, it's also $200,000 cost to society because there's no productivity whatsoever. That's just, I like it because Mercy's at the Spanish Steps and everything. So what are the conclusions I want to give you and leave you with? There is an increased risk of SGA. I'll give you that, right? An increased risk of low birth weight, I'll give you that. Increased risk of preterm birth, I'll probably give you that. Decreased risk of diabetes mellitus, decreased risk of cesarean section, decreased risk of pertussis in the active phase. Preeclampsia, very low birth weight, probably plus or minus mixed. Increased depression, suicide, anxiety, sleep disorders, those are there with abortion, no matter when you do it, 15 or not. Increased risk of mortality, increased risk of breast cancer before incident of pregnancy, preterm birth rates, illicit drug use, child abuse, cost, and all these are avoidable by not performing the abortion on the 15-year-old. So my response is always, is it safe, rare, and legal, is the question I always ask. And is there a benefit, health benefit, to those of us who take care of these young women who are 15 years and under, of having an abortion versus having their child? My answer from the scientific literature is no. Unless I'm going to tell every one of my diabetics, every one of my chronic hypertensives, everybody who has any sort of medical problem, or even a lady who's over 35, quote unquote, but that they should get pregnant because, or abort because they have an increased risk for preeclampsia, SGA, and preterm birth. And it's almost exactly the same as a 15-year-old. It's portrayed Good care ameliorates this in several studies. Certain morbidities are increased and manageable with routine obstetrical care, particularly early onset care. Certain significant morbidities are decreased, which we just talked about. Outcomes are maybe influenced by the modification of risk-taking behaviors, that is, tobacco, alcohol, and drugs. What a surprise. And early entry into prenatal care as well. Focused care and specific needs of very early adolescents may ameliorate or actually prevent some of these particular morbidities that we talked about. Does anybody know where this is? That is Mount Rainier. That was when I was in the military. I really thank you, because that was a view out my window every morning. Do I have time for any questions?